Hi, I'm Dr. Trussit Dave from Dry Eye Doctor. One of the most commonly asked questions I get in my dry eye clinic is why do my eyes burn and feel sore when I've been working on a computer? In today's video, we're going to discuss a case study and some tips to help you manage these symptoms at home. Okay, so let's take a look at our case study. One of the first things I do when I have a patient come and see me is to get a grasp of their symptoms, so I put them through an OSDI questionnaire. Although this patient had symptoms of burning and grittiness, this OSDI score of 60 indicates that they probably have dry eye. So a normal OSDI is anything below 13. The next thing I decided to do was to evaluate their tear film, and the best way to do this is something called a non-invasive tear breakup time test. As its name implies, we don't put anything inside the eye, and the computer calculates areas of instability of the tears, and we can see that the instability is all in the lower third of the cornea. So what did we do next? Well, the next thing was to evaluate the actual damage on the eye. So we put a little dye in the eye and see if there's any staining. We can clearly see here that there are these little dots which indicate dryness and damage to cells. The video also shows that as the patient's blinking, they're not making complete blinks, and we're getting these patches at the bottom of the cornea where the tear film is definitely drying out. In fact, if we look at a video slowed down 10 times, we can actually see that this patient is not making full blinks. They're half blinks and incomplete blinks. So what has this all got to do with computer use? Well, a lot of research has been done, and the bottom line is that when you're using computers, you tend to blink a lot less. In fact, some studies show that you blink 5 times less. The other thing is, a lot of people these days are using smartphones, and the latest research also shows that you tend to make 2.5 times more incomplete blinks. Why is this important? Well, the action of the eyelids coming together causes a release of a tiny droplets of oil through those glands in the eyelid. And if you don't blink properly, or you blink incompletely, then the eyelids never come together and you get far less oil in the tears. That can lead to blockages of glands and what we call evaporative dry eye, which is what we see here. So, what are the top tips for you in terms of managing this? Well, simple thing, the 20-20-20 rule. Every 20 minutes, take a 20-second break, move away from your device, and look 20 feet away. There are other things you can do as well, like take non-preserved artificial tears. There's a whole host of them around. And if your glands get blocked, then warm compresses at home at least once or twice a day can be really helpful to liquefy those oils. A final tip is to blink more frequently. Now, this is really difficult to remember to do, but if you can remember this during your 20-second break, then the easiest way to do this and to make sure you do full complete blinks is to put your index finger at the side of your eyes and do a forced blink. You should find that you can feel that muscle twitch away as you make that forced blink and your eyelids come together. I hope you found this video useful, and thanks for watching.